Thank you. Good morning and welcome to the November 3rd, 2020 meeting of the Humboldt County Board of Supervisors. Before we begin, I'd like to invite you to join me in a salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Before we begin the meeting, I would like to congratulate and thank our new duly appointed County Counsel, Jefferson Billingsley, and Director of Library Services, Christopher Cooper. Thank you very much. And so with that, I'm going to CAO Nielsen. Good morning, Amy. Any changes to the agenda, modifications?
Good morning, Chair Fennell. There are no modifications to the agenda today.
Thank you very much. Okay, with that, we go to the consent agenda. And before we do anything, I'd like to invite Supervisor Madrone to make a presentation. Good morning, Supervisor Madrone. Oops, your microphone.
There it is. How's that?
There you go.
Yeah, Chairperson, I was thinking that maybe we ought to have a motion and a second for the agenda first before I read this item.
That's fine, or you could make that motion after you do it, but either way, okay, I'll entertain a motion on the consent agenda.
I'll move that we approve the consent agenda.
Second.
Motion and a second. Okay, there you go, Supervisor Madrone.
Okay, just wanted to follow protocol. So this is a letter of support. I know we normally don't read letters of support. We normally just pass them and move them forward, but this is an important one and I just wanted to read it into the record. So this is a letter of support for a legislative proposal, including the repatriation of Katamin and Amenikaram Karuk sacred sites. So this is to our congressman. On behalf of Humboldt County, please accept this letter of support. This legislative proposal would right a wrong that has prevented the Karuk people from free and unfettered access to their most sacred place. The Karuk people have lived and conducted ceremonies at Katamin and Amenikaram since the beginning of time. The Karuk tribe's historic and present-day government-to-government relations with the United States is due in large part to their continued presence and traditional and customary uses of Katamin, Amenikaram, and several other ceremonial areas. These areas are integral to understanding Karuk cosmology and creation, as well as the perpetuation of Karuk customs and culture. Ceremonial leaders conduct ceremonies and rites regardless of the occupation of these lands by others. Natural resource utilization and management remains a vital part of Karuk culture. The harvest of salmon, acorns, deer, elk, mushrooms, and other natural products still serve as subsistence for many tribal families, while the act of hunting, gathering, managing, and processing these natural food products help define the Karuk's tribe's cultural identity. The Karuk tribe's aboriginal territory encompasses over 1.48 million acres of Northern California and Southern Oregon. Currently, 95% of Karuk aboriginal territory is managed by the Six Rivers and Klamath National Forests. As a result, the tribe struggles to ensure that traditional management practices and Karuk cultural values are integrated into management decisions. We support the Karuk tribe's effort to ensure the repatriation and management of these sacred sites so their tribal ceremonial leaders and traditional practitioners will have access to these lands for traditional and customary uses in perpetuity. Sincerely, Chair Estelle Fennell. Thank you, Madam Chair.
Thank you, Supervisor Madrone. It is a pretty fitting beginning to Indigenous Peoples Month here in November.
Absolutely.
2020.
Thank you for letting me read that in.
Any other comment from the board on the consent agenda this time? Okay, is there any public comment on this, the consent agenda? I believe we have one caller. That's 3053. Welcome.
Good morning, Thomas Mulder here. I just want to clarify, you can hear me?
Yes, we can, Thomas.
A couple of things I want to comment on. One, the first is the appointment of Dylan Mattoll. I think that's a great pick by Supervisor Bohn. I think he's a good community person. I've met him a couple of different meetings and had conversations with him. The only thing I want your board to consider is you have different people in the cannabis industry serving as this advisory committee, and I hope they don't get negatively scored or affected if they do have projects that are associated with that are good projects that should get funding. So keep that in mind whenever funding recommendations come before your board. And the second thing is on that private roads ordinance, I stayed on the call last week. I want to make sure that there's protections in place for private residences if law enforcement is illegally patrolling private roads and try to overstep their grounds. That's the reason I stayed on the call for 8 hours last week. So I want you to make sure that there's protections. Let's say Salmon Creek Road, the private road. If law enforcement is out there illegally patrolling and it's not in this ordinance, that there's some sort of repercussions on law enforcement for illegally patrolling. That goes for any other, I don't own property on Salmon Creek Road, but that goes for any other road within Humboldt County, because I think it's going to open up a big can of worms where law enforcement is going to be illegally patrolling roads. And I want you to take that into consideration before you pass this ordinance. Thank you for the opportunity to speak.
Thank you, Thomas. And I do not believe if there's anyone in the public who wishes to address the consent agenda, you can press *9 and you'll be moved into the queue. I don't see any other hands up. I'll bring it back to the board and go to Ryan for a roll call vote, please.
Thank you, Chair Fennell. Supervisor Bass?
Yes.
Supervisor Bohn?
Yep.
Supervisor Madrone?
Yes.
Supervisor Fennell?
Yes.
And Supervisor Wilson?
Affirmative.
Thank you. Passes 5-0.
Thank you very much, everybody. And that will bring us to our time set item this morning. It is an update on the COVID pandemic. And we have our health officer, Dr. Teresa Frankovich, as well as Director Michelle Stevens of Public Health. And I believe the sheriff will be joining us as well. There he is. Good morning, Sheriff. So let's get an update, if you wouldn't mind. I know there's been quite a few developments recently. We're looking forward to hearing from that update. Oops, Doctor,
I know, I got her. You'd think I'd know by now, right? So a couple of things I just wanted to mention. I'm sure people are well aware that, nationally, the trend is increasing, and not entirely surprising, both in terms of openings, but also most likely because we're seeing an increase in the winter, colder weather. Fall and winter, people are moving indoors. We know that transmission occurs more easily indoors. And so we knew that this would be a bit of a struggle going into the fall and winter months. Globally, we're clearly seeing increases in Europe, in England, Canada, Scandinavia. I mean, lots of places are dealing with this. In the US, of course, we're breaking records, daily records for new cases. And so when we look at the country as a whole, for a long time, California stood out there as a really problematic area. When you look at the color-coded maps, now the center of the country really is experiencing a lot of disease. So the central and the Midwest, but now we're also seeing in the mountain states, the Northeast is starting to tick up again. And I had an email recently from the state health officer noting that California is ticking up again too. So I think it's just good for us all to be aware that, we're gonna need to be using some increased caution as we head into this coming season for a lot of reasons. California has about 944,000 cases to date with about 17.7 thousand deaths. And our case rate increased in the state to 9.1. That's a lot better than some of the other states are dealing with right now, but it's more than we've been seeing. So we're watching that. in Humboldt. I believe we reported 579 cases yesterday. We had, that was a total of 8 from the weekend. And then I do know that we have a number to report today as well. So we've had a few weeks now with some lower case counts, and we've been enjoying that. But I just want to caution people, as the number of cases go up in other areas of the country and the state, we get impacted by that as well. And so particularly through travel. In terms of the tier system and the framework that the state has put in place, we are currently in the yellow least restrictive tier. Our metrics last week were in the orange. Our case rate was 2.8. Anything over 2 puts us in orange. But we expect that the tier assignment for this week will remain in yellow because our numbers our case rate's down a bit by our internal numbers. They're a little delayed this week releasing those. We'll get those later today, probably to public health, and they'll be publicly released tomorrow, is what I understand. So, so far so good in remaining in that tier. Couple things just to update the board on. In our communicable disease department, they're working like crazy, but they are also trying to onboard into the state case investigation platform called CalConnect. And we had initially been working from our own database, but we're moving into this for several reasons. One of which is that it does allow us, if needed, to utilize state contact tracers. And so because of a shared framework, so we're doing that. And also simply because with the number of cases we now have, our data needs are just growing. And so it'll just give us some flexibility in terms of tracking some of the reportable things that we need to track for our metrics for the state. In terms of the testing frontier for COVID right now, again, locally, where our capacity is in our internal lab is testing about 200 specimens a day. We Optum in the ever-moving target that is Optum. The state has now said that they will continue Optum into the spring. They note that at some point the counties may need to contribute into the cost of that, but not yet. And their plan is, rather than those labs going into the commercial lab, that they'll go to the large state lab that's just getting underway in Southern California. So they're planning for a better turnaround time, but they'll need to ramp up their production. Their goal is 150,000 tests a day, but it's going to take a while for them to get there. And then regionally, we've been working on, as you know, our regional testing partnership with UIHS and with Del Norte County. At this point, the lab has run some sample testing, and that process looks good. They're finalizing those processes. The big lift right now is making sure we get the web platform up that will allow scheduling and allow people to access their results online, which is really important for this system to work. And of course, our goal is to be able to do 400 to 500 tests a day through that lab alone. So it's a huge asset for the community, and we expect the same turnaround times that we have at our own public health lab of 24 to 72 hours, which will really help. The Optum has been a good underpinning, but I can tell you that even with these cases we announced Monday, some of these cases, by the time we get the results, are ready to come out of isolation. And so because of a lag of 5 days or that, it's better than some of the times we've had, but it's still not as quick as we would like for good case follow-up. And then just a couple other notes. Vaccine, we're in meetings with the state and with our community partners about COVID vaccine and planning for that contingency. How that will look, who will have doses, prioritizing, all of those things are discussions that are ongoing. And one of the biggest issues right now is Pfizer is the company that is likely going to have one of the first vaccines on the market. It requires a deep freeze. Those like a -70 freezer. Those are not things that most offices or hospitals have on site. And so we have been working with our hospital partners on that. And initial doses are slated for healthcare workers. I think it's likely it's going to be the beginning of the new year before we're seeing these doses. But we shall see. Right now, as I understand it, Pfizer has still not turned in their documents to the FDA for review. They're still working on closing out their study. And flu vaccine, we did a lot of doses. We'll be having some ongoing community flu events, but the drive-through, I understand, went very well. And I think they did, I don't know, Michelle, I think it was over 400 doses. So that was good. We also have done some school sites open to staff and family members and students. And again, some broad community events will be planned. And another thing we're working on right now is working ongoing with our schools, K-12, as well as our colleges and university settings on plans both for this term and our contact investigations, that type of thing, as well as for the higher ed, their plans for the next term and what's that is going to look like and what the needs are. So we'll see. And of course, today is voting day. We have our JIC actually put together a training video on COVID safety for polling places, which was great. And the state's guidance on safety in polling places was pretty robust. And so we're envisioning those polling sites operating well under COVID conditions today for people to be able to vote who are voting in person. So I think that's all I was going to mention today, unless there are questions.
Thank you, Dr. Supervisor Bass.
Thank you, Madam Chair. And I think I have like 4 questions because I got a few calls this last week that I just wanted to bring up today. But the first question is, you mentioned that today we're going to see some numbers as well. And so that's kind of an ominous sounding thing. I'm curious if you're seeing something that you can trace to a specific event, or is it just from multiple sources?
Sure. The cases that we had come in over the weekend, there were, I believe, 2 of those 8 at least appeared to be clearly travel related. There was, I think, 1 or 2 that were contacts, and the others are under investigation. We don't have at this time a source. So we don't have one large ongoing outbreak right now. And of course, we're always watching for these sporadic cases that come in unrelated to anything else. So.
Okay. And then last week I was on the phone call, and Supervisor Bohn might have been on some of these or similar ones about what we were calling the Shasta rule. You know, Shasta had their huge, quite large outbreak. Mm-hmm. And in theory, yes, last week they should have been moved to the lower level. Mm-hmm. But there was, because we were on the phone with Dr. Galley, and it sounds like they're willing to look at circumstances before automatically shifting a county down. And I wanted to get your sense on that.
Yeah, there's a built-in adjudication process that's sort of been revised and refined over time. So in Shasta's case, you're absolutely right. They had 2 significant outbreaks, one related to a church entity and another related to, I believe, an assisted living facility or skilled nursing facility. And so they were able to sit down with the state before you move a tier and have a discussion about what's driving the data. And also, I think they were able to show, because remember, the state tiers data lags behind. They'll be reporting today or tomorrow on data that ended the week of the 24th. I think Shasta was able to demonstrate that in real time, their numbers were actually starting to decline. So they were already improving, and it seems silly to move them back and forth. So I would envision with Humboldt, we'd have those same discussions if we thought there was, a reason that we should be able to hold tight.
Yeah, and I know people, well, a lot of us aren't really happy with the state and what comes through there, but I have been, on enough calls that it sounds like they are trying to find ways to help counties. I do think. So, and then a question came to me last night, and since we're on today, regarding food service places, whether to go or, drive through or sit down. And they were noticing that while servers wear masks, often in the kitchen, people aren't wearing masks. And I was curious what the rule is on that. I probably could have looked it up, but since you're here, and then one other question. Sure.
Yeah, no, it's everyone is supposed to be masked. Everyone is supposed to be using a facial covering in the workplace. So I understand in the kitchen setting that, may be less comfortable where it's hot, but there are certainly lighter weight masks that people can use. But no, they are.
Okay, and I know, the people that were talking to me were concerned because of the folks directly making the food probably should. So just wanted to confirm that. And last one is travel, whether, I know we're not necessarily encouraging, but we can't expect people to stop traveling, I don't think, completely. And there are several who are traveling by plane. And there are some communities that people are traveling to that you have to have a negative test that had been taken within like 48 hours or 72. What would you suggest for someone who needs to have, to try to actually get somewhere? You don't want to get on a long distance flight and then find out your time frame lapsed because one of your flights got canceled on the way or something.
Yeah, I mean, you're right. It's sort of a tough position right now because there's not universal access to the rapid point of care tests. And I should point out that those tests are actually not really even designed to be used in asymptomatic people for screening, but they're being put to use for that. So, there are some provider offices and hospital settings and such that do have rapid testing that's available. But I agree, it's challenging, especially if you're traveling long distances, that your test is not obsolete by the time you get there. So one thing I would suggest to people is, as pharmacies and other places get into the act on some of the rapid testing, that they can look at their destination as well and see if there's a rapid care, urgent care point of contact, point of care kind of test that they can access on that end as well. But you're right. In general, we're trying to encourage people to stay close to home. It's one of the big concerns we have heading in, right? We always know that flu season upticks after the holidays because everybody's mixing and traveling. And, we have those same concerns now with COVID added into the mix, is the travel and mixing. So we encourage people, if they do travel, to do so as safely as possible, and use all those preventative measures we've been talking about.
All right. Well, thank you. I think that was my list.
Sure.
Thank you, Supervisor Bass. Any other questions or comments from the board or doctor or the director? Sheriff Hansel, I know the last time we had this presentation, you were able to say that you were investigating whether or not one of the cases was actually COVID related, the deaths. And have you been able to determine that yet?
Not yet. We have not got the lab results back from the autopsy. So once that happens, then we'll be able to release the cause of death.
Okay, great. Thank you, Sheriff. Any other thoughts on how people should keep doing as well as we have done up to now?
Well, honestly, I think again, when I look around, we are incredibly fortunate where we're sitting right here. And as I go through the county, I look at the folks masking, and I can see that that's a huge piece of this. And I'm sure everyone is seeing this nationally. There's lots and lots of data coming out about the efficacy of masking and distancing. A lot we didn't understand out of the gate, but we do now. And so I really ask people to continue that. Our CD team can help to make up for some of the things that we do that are riskier by trying to capture cases quickly and isolate them. But I just want to remind people that that's precarious. Places, if we look at Shasta, when you start to have daily case counts of 40, 50 cases, you cannot. No one has a team big enough in counties our size to be able to aggressively manage those cases quickly and contain them. So it's easy to get out of hand. And we really count on everybody doing this ongoing. I know it's hard. We're all sick of it, frankly. But I think that if we can hang on through flu season with the measures that we have in place, I think we have a chance of doing well through this. And so I think it's worth the effort on all of our parts.
Thank you, Doctor. Supervisor Bohn.
Yeah, Dr. Frankovich, thanks to you and your team for everything you're doing. Hey, when we get to the point where the Shasta rule comes up, and I've been following that and talking to the supervisors over there, and we go a couple numbers, a little bit over and things like that, and then we get to appeal to the state.
Yeah.
Who's on that? Who gets to talk to the state on that? I know over there they were using the CAO and the health, and I think even the sheriff was involved trying to make their case that, we're right on the cusp, but we've been doing so well. Who is on that team that fights for us? Just so we have a good cross section.
Yeah, it's a really good question, Supervisor Bohn. To be honest, we haven't been near that place, so I haven't been worried about it and haven't really looked at their rules. My sense is, from discussions I've heard, is that we have that opportunity to invite on our end people we want in the room to be part of that discussion. So as you mentioned, I think it'd be important to have several voices in the room to sort of address this. Both from the board's perspective and as well as the CAO office and such. So I think we could have a robust discussion, but what we would probably do is meet ahead of time locally and go over our numbers and what case we're making to the state, and then go together as a state make that argument.
Because every week we talk about, hey, we may jump into the other tier. So I've been worried about it. I'm glad to hear you're not worried about it.
No.
But I would actually like to have this team put together sooner than later. And then rather than here, state turned us down, we didn't have time to put a team together. So I'd like to see it happen.
Yeah, Supervisor Bohn, what I mean by that is, again, because of the time lag in the state data, I'm looking at data that's now 1 and 2 weeks past what they're looking at. So we know if we're going to, if I knew we were looking like orange again for a second week in a row, we'd have already been having this discussion. So it's just because of the time lag that it gives us a little bit of preparatory time up front.
So it seems to me that just looking back on several of the past reports, we kind of teetered close, but we knew that we were actually going to be okay with the upcoming numbers. So I think that in a way, we've already been practicing that. It's just not gotten quite to the state.
Right.
And I think the state does understand that.
And I'm happy to look at, I'll see, if there's a, sort of recommendation or guidance for the members of a group coming to the state. If there's not, we can make that decision locally.
Yeah, okay, great. Thank you. Any other Supervisor Madrone?
Yes, thank you, Madam Chair. When we look at the weather, it's not surprising the Midwest and the Northeast, we're seeing a tick up in terms of relationships to health, because they've been under a deep freeze for the last couple of weeks. With our high pressure pattern here in the West, we've been enjoying this endless summer, but they've been in a deep freeze now for several weeks. And so, as we all know, cold weather pushes people indoors and cold spread and all that kind of stuff. Well, guess what? We're looking at a pattern shift here later this week on Thursday and Friday. We've been locked into high pressure for a long time. We're moving into low pressure. And often these things are pattern changes that last for a while. So it wouldn't be unusual for us to be entering a month or more of a cold, wet season. The start of the wet season is supposed to happen. Thank goodness. Put the fires out, right? Sheriff Hansel, let's douse those flames. But, just again, that extreme caution to our community that we are doing so well. Let's not lower our guard right now, especially with this cold weather coming in. We're really going to need to double down on all of the practices we've been doing. So just wanted to add that cautionary note about the weather.
Yeah, appreciate that. I did forget to mention that I am putting out just a revision to our previous order, because it, our standing order still references the old framework from the state. We wanted to just have the new order that references the new tier system that we're operating under. So that will go out as well.
Sheriff Hansel?
Yeah, I just want to update the board on one thing. I know that many of you have been tracking the state prison system and the massive release of state inmates due to COVID. Well, I'm happy to report that the state now has opened up the intake portion. We had 30 to 40 inmates that were sentenced to go to state prison that we've been holding on to for months. So the state prison system has finally opened up. We were allowed to transport 30 inmates from our county jail to the state prison system. So that has a huge relief on our correctional facility, and then allows us to, again, get more people shuffled around to the areas in the jail that they need to be in. So that's good. Also want to remind people too that the courts are opening up, and that there's more jury trials going through the Superior Court now. And so if you do get a jury summons, please, if you're healthy and able to do so, please participate in that process, because there is a huge backlog in jury trials, and we really need to get these things going through. And if you're an able-bodied person that can, healthy enough to go and do jury service, please do that.
And just as a note, public health has worked with the courts as well on, and they received robust guidance from the state on operating safely under COVID. So, I agree. I really encourage people to answer the summons.
Thank you, Doctor. Thank you, Sheriff. All right, let me open this up for public comment. Is there anyone who would wish to speak on this item? I don't believe we have any public comment on this item. Ryan, you see anyone?
Oh, you're correct, Chair Fennell. There's no public comment for this item.
Okay, great. Well, I want to thank you all very much for all of the work you're doing, and let's not let our guard down. We're doing so well. So let's keep going.
Thank you.
Thank you so much. Goodbye. Bye, you guys. So that will bring us back to the main part of the meeting, and the first item now is public comment on non-agenda items. Is there any public comment on non-agenda items? I don't believe we have any, Ryan? No? Okay.
Chair Fennell, you're correct again. There is no one here for public comment on non-agenda.
Thank you. Maybe everybody's out voting. That'd be kind of good. So the next item on our agenda comes to us from the Public Works Department, and it's actually a public hearing, an annual one. Welcome, Director Matson. Good morning, Tom.
Good morning, Chair Fennell, members of the board. If you would open the public hearing.
I opened the public hearing right now.
Thank you. This is our annual unmet transit needs hearing we hold to assist the Humboldt County Association of Governments in gathering information from the public for unmet transit needs. Please note as well that HCOG has requested that due to the drop in transit ridership of 70%, that the public also weigh in on how they feel about getting back on transit and others of moving people back into transit and getting that system running in a robust manner with all the traffic it can handle. With that, the unmet needs are basically at a minimum, trips requested from residents who do not have access to public transportation, specialized transportation, or private transport services or resources for the purpose of traveling to medical care, shopping, social recreational activities, education, training, and employment. So having said that, over the last 2 years, both last year and the year before in these hearings, residents have requested transit in the Samoa area. I don't want to let that go. We are working with HTA to maybe try a pilot program out there. And also 2 years ago was brought up the additional transit services in McKinleyville, and that's still circulating throughout the community as well. While neither of those was found to be an unmet transit need at the time by HCOG, there are still people out there who would like to see those services. Just to note that currently the county funds Redwood Transit System, Eureka Transit System, Eureka Dial-A-Ride, Southern Humboldt Intercity, Arcata McKinleyville Dial-A-Ride, Adult Daily Healthcare Mad River, Humboldt Senior Resource Center, Willow Creek Extension Route, KT-Net in Old Arcata Road. And we also set aside $200,000 a year for transit agencies to buy new buses. With that, if there, Marcella May from HCOG is also on the line. If she wanted to add anything to kick this hearing off, I would allow her to speak at this time.
Thank you, Director Matson. Welcome, Marcella.
Thank you very much, Board of Supervisors. Tom did an excellent job. The only thing that I will add is that we do have some outstanding unmet needs. One was made 2 years ago for a pilot run of late night service on the regional system from McKinleyville to Fortuna. The Humboldt Transit Authority secured funding to start that pilot project until COVID hit. Those funds had to be redirected for free tickets for the transit system because of the low ridership. We also have a finding last year to increase add additional bus during peak hours, during the mornings and the evenings when people are going and coming to work. Due to COVID, we're not moving forward with that this year, but this year and the following year, those two unmet needs will be automatically analyzed to see if they still meet the criteria. And with that, I can answer any questions.
Thank you, Marcella. Any questions or comments from the board before I go to public comment? Supervisor Madrone.
Yes, thank you, Madam Chair, and thank you, Director Matson. And ED, or I forget what your title is, Marcella, but thank you very much for your presentation. Yeah, I just wanted to reiterate that we continue to have tremendous input in McKinleyville regarding unmet transit needs in McKinleyville. We had a robust meeting last week with the MCMAC. There was some public input as well as a robust discussion about the needs in McKinleyville. And luckily, thanks to HCOG ED, Marcella May, as well as Colin Fisk from the Coalition for Responsible Transportation Priorities and others, we've developed a pilot project in McKinleyville that's looking at transit systems, services, needs, et cetera. Marcella could probably talk about that in more detail than I, but that's moving forward. And while we do have Humboldt Transit that kind of routes its way through McKinleyville, as I've said before, we really don't have a intercity bus system there, and it is desperately needed. So I once again want to speak up for the community, for McKinleyville, for its unmet needs. And it looked like there was going to be some money to do that last year, but then of course revenues were looking to go down. But apparently revenues are actually up. And again, Marcella could talk about this more, but apparently sales tax are up at this point in time, which probably all the people fixing their homes and the hardware stores are just going crazy out there, right? At any rate, I just wanted to speak for McKinleyville once again and see if we could get something started there in 21, 22. I realize right now is not the best time to start up any kind of new service with COVID, but I think we all hope that by next July 1st, we might be in a great place again as a nation, as a community, and would be a great time to start up this service. So want to speak for that again. Thank you.
Thank you, Supervisor Madrone. Supervisor Bass.
Thank you, Madam Chair. And if I look different, it's because my computer on my desk died, so I had to call back in. So if this was covered while I was attempting to get back, let me know. But I know Director Mattson mentioned the Samoa area, and I know that has been on people's mind a lot out there recently, especially with the townhomes, the Phyllis Rex complex, you know, going to be opening up soon with at least 30 some families. I mean, there's reasons to be, you know, I think to look in the future to having people that are interested in getting to town or getting around. And as Samoa develops with the Samoa Town Master Plan, as well as other industry out there, it just seems like it is a good thing to look for in the future. And so I did talk to folks to send in their comments. And I guess my question for Marcella is, beyond today, will people still have another opportunity to file? I mean, I assume you guys are having a public hearing also, HCOG, or not? Okay, and what date would that be? Because I've been asked to find out when the last time to submit anything is.
November 19th.
Okay.
Go ahead, Marcella.
Yeah, the HCOG's meeting is on the 19th, and I'll just say that the law requires only one public hearing, so we're very thankful that our local governments also include them on their agendas. We will accept unmet needs comments year-round. For each cycle, though, our deadline is December 31st. So for the 21-22 year, that's going to be our deadline for analysis and consideration. And the other thing I'd like to make clear is this board does not have to have an unmet need to use your TDA funds on transit. So that is not a step required. What happens is that if a new service, say Samoa, is started, the funds will be audited by our auditor, and we look to make sure that we're getting near the 10% fare box requirement, which is this year due to COVID. But you do not need an unmet need finding for you to use your transit money on transit.
Okay. Well, thank you, Supervisor Bass. Supervisor Bohn.
And after serving on HTA for almost 8 years, and I think Supervisor Wilson can back this, I believe in 2021 there is a pilot program scheduled for Samoa. So to see what the need is, and then as things evolve and going from there. And then I know that Supervisor Madrone has been to meetings, and you know, everything gets looked at. Unmet needs that we've done through HCOG is we started a Sunday service on Redwood Transit in 2014. 2018, we started an old Arcata road service for students and people needing to get to Arcata Eureka. And so we started that service. But besides that, we, 2010, the Southern Humboldt between Miranda and Bimbo, late night hours on RTS till 11 o'clock. We've done student passes, jack passes, discounted for students. These weren't unmet needs. These are just things that have been implemented by HTA. We purchased a zero emission electric bus, and now we're looking at hydrogen. We've opened up Saturday and Sunday bus service for Southern Humboldt. I think that started in 2019.
Yes, correct.
We did free rides for the first 2 months of the pandemic and got all our buses set up for that so people would feel comfortable and getting around. So the COVID thing has thrown our economics into a tailspin, but I think Greg Pratt and the team at HTA they bring something to us every month, and I think they are looking forward to any expansion that will meet that 10% of the fare box and make it work. So I think that the effort has been being made on a big basis over the last, we've done great under his tutelage, and his staff have done a great job. So FYI, because we taught HCOG, eventually when the rubber hits the road, it's the HTA's rubber hitting the road. So thank you.
Greg's done amazing work, and the whole team, really thanks everybody. Supervisor Wilson.
Thank you. I just want to thank Supervisor Bohn for his outline of all the service changes that we've seen over the last some years, and they are in both response to these requests, this process that we go through, but really it is, as was alluded to here, an iterative process throughout the year. I'm on the HTA board as well, Humboldt Transit Authority, and we receive comment and suggestions from the public year-round that are basically aggregated in this year-end process. And I want to thank the board for basically adding another forum for the public to engage. But I often just refer constituents directly to HTA to have their comments put into the process, and I think it works really well. And there is, oftentimes the unmet needs are really the fringes of the service population, in that it's just not on the core corridors, and sometimes they work and sometimes they don't. Sometimes we have great success, and other times that these are pilot projects to see where we can go, and also an acknowledgement that the information and technology of transportation is changing dramatically in the current context. 10 years from now, it's not going to look like 10 years ago. And this dramatic shift is, a way we have buses and those sorts of very large vehicles that aggregating a lot of people. And in many communities, they're moving to smaller vehicles, oftentimes electric or hybrid, and on demand as part of the feeder systems to the centralized systems. That's just a demand related systems. So anyways, it's great that we're here. I'm glad we're taking any public comment that may show up here today, and also just reiterating to funnel all of our constituents' concerns to HCOG and to HTA at the time that they make them. So thanks a lot.
Thank you, Supervisor Wilson. And then I'll reiterate what both you and Supervisor Bohn have said. The HTA does a wonderful job. Also with regard to outreach, I know that when we were dealing with the Southern Humboldt area, lots and lots of meetings, sometimes just a few people, but very, very helpful, and really appreciate that. Supervisor Madrone, did you have your hand up again?
Yes, I did. I was going to make a motion, but I thought maybe I should wait till we hear from the public.
Yeah, it's that hearing from the public is part of that. I did, well, I'll let the public, I know there is one issue that came up that I'd like to bring up, but let's see if the public member has that. We do have at least one caller who'd like to speak to us, and it says the last 4 digits of 0150. If you can press *6, you can join the conversation. Welcome.
Good morning. This is Dottie Russell from Southern Humboldt. And I wanted to bring to your attention a little bit about an unmet need. The FRC, the Public Health Outstation, advocates as well used to be able, and caseworkers used to be able to give some passes to different people that were either houseless or experiencing poverty to go to the welfare office and to go to different meetings that they needed up in Eureka and Arcata. And as far as I know, none of those passes have been given out for quite some time. Every time that anybody asked when they needed to go someplace up there, they were told that there weren't any passes available. So if we could reinstate that that offering, it would really be helpful rather than people trying to either hitchhike or ask somebody that has a car that maybe wouldn't even make it up there to get them there. And worse than that is that there are people that drive around and look for people to kind of prey on them who are desperate to get to Eureka or Arcata, and they don't have the money, and so they get involved in some interactions with people that they shouldn't be involved in. So that would be a big help if that could be changed. The other thing, as far as I know, there's not a monthly pass that includes Southern Humboldt all the way up to Arcata. If there could be a monthly pass so that people could travel locally in Southern Humboldt, but as well get up to the other areas, I think that that would be helpful. I think it might bring in some more revenue and it might get some more ridership. So thank you very much.
Thank you, Dottie. I believe that's the only public comment. I'll bring it back to the board. Supervisor Bohn.
Yeah, through the chair, the passes that the last speaker talked about, it's as easy as just calling HTA and asking them to have them replenished. And I imagine Supervisor Fennell will do it after this meeting. And since she's in the chambers, we'll probably take them home with her today. So.
Thank you, Supervisor Bohn. Appreciate that. The public comment that we got here, and I'd just like it to be in the record, was from a resident of the town of Samoa asking for a bus stop in Samoa. It says that the bus just passes by Samoa and goes on to Manila, and so would like to see a bus stop in Samoa. Any Supervisor Madrone?
Yes, Madam Chair. I really look forward to the day as mobility on demand, electric vehicles, and all kinds of other new innovative things start happening with our system. But for now, we have what we have, and I would make a motion that as a board, we support pilot projects both in Samoa and in McKinleyville to start up funding permitting. And, you know, I say this, I'll just say as a comment, separate from my motion, that McKinleyville is in the core population. It is the third, if not the second largest city in Humboldt County, 17,000 people by all estimates. And it really does not have a bus system. It has the transit that comes through and stops at a couple places, but it doesn't really serve the community for getting around McKinleyville. So, you know, 17,000 people, I have no doubt that we'll meet that 10% fare box, and it is core population. So thank you.
Thank you, Supervisor Madrone. Any further public comment on this item, or any further discussion, I should say? Supervisor Bohn.
Is there a second on that? Did somebody second it first?
I'll second the motion. I was
Okay,
wondering the
because
same.
Samoa is starting in January. So if we fit that, it'll go really well. McKinleyville, I think they're looking at putting a pilot program together. I don't know if are we directing HTA to do it or to just keep on investigating?
I think
one clarification, just what we're voting on.
I think that this is just for public input. This is a hearing for input. I don't think
That's
there's
what I
any
thought,
direction involved. Yeah,
That
that's
was
why I
all.
didn't even ask for a second. But maybe Supervisor Bass.
Yeah, actually, Madam Chair, you know, 'cause I wanted to be able to have some discussion, so I seconded it for discussion. So it was after the comment was made. My question is, since Supervisor Bohn seems to be on the inside track of what's happening, my understanding when I was over doing a tour of the townhomes is that the pilot program was going to only the people living at those apartments, and that's where the pickup was going to be. So if you have further information that it's available to anyone from Samoa to stop at, that's not what I was hearing when I went over there. So that'd be helpful if you could clarify that, since you're so very involved with that process.
Well, and it's one of the many committees.
Supervisor Bohn.
It's one of the many committees, and I know I've sat through. I've seen Supervisor Madrone's presentation. He came to one of our board meetings, and I didn't see the robust meeting at the McMac, but I firmly believe that they have the population to support it, and it doesn't cost. I should say it costs us all, but to get that 10%, I don't think is a problem. It's basically evolving into making it happen, and I think you've got a commitment from the board to do that. I kind of felt that there was commitment to work forward, and then COVID hit, and we could start it in 2 weeks, but you're not going to hit your 10%. I got a feeling with COVID. So so there's no reason to implement something into failure till we actually get to July 1st or whatever the dates we're picking to get out of this mess. But I think what we need to do is, before we say, because there was no end date, no start date, before we start making motions for direction to HTA, and I'm just looking at this, is that we look at this, and then I think the same thing goes with Samoa. I don't know the exact stops. I just know there's a pilot program starting in January because we're committed to that already. And I got the definite, and maybe Supervisor Wilson can help me. I got the definite idea that we were committed to starting a pilot program when we get it funded. We get the funding, which I think there's funding available, to do a McKinleyville program to go off. We do go through the main drag, kind of like a lot of our buses do here. And then Eureka has its own system that we're now running that feeds to our corridor. So I think it's being done. I just don't know. I don't know what we're asking them to do, and maybe Supervisor Wilson can straighten it out.
Maybe, and I would just like to suggest to Supervisor Madrone that maybe the gist of what you were saying is that a robust message from the board that this is a concern, just, as part of the input. Supervisor Wilson, and it could be even a vote. Supervisor Wilson.
Yeah, I was just going to say, my understanding, this is a hearing to take public comment, and I'm looking at the agenda and the way it's written. And I don't really even know how to give direction to HTA other than through Supervisor Bohn and myself. And I think that the comments here are direction enough from my perspective. I would ask that Supervisor Madrone adjust the motion to just receive the comments from the public and the board and put them into the record as per the agenda item. Specific instruction, I mean, we can carry that as members of HTA and what we've heard today in the form of comment, but I didn't really see in the agenda how it's written that we would actually give direction. So I don't know, I'm just a little, maybe Jefferson has a different interpretation of that, but I don't think it makes a fundamental difference other than just through the process. That's all.
Through the
County Council and then Supervisor Bohn, Council Billingsley.
I would agree that the direction is to provide the comments. I mean, obviously those comments could be from the public and could be from the board.
Right.
If you want to have a more formalized version of those comments, there could be a vote regarding the comments, but I think what the board members are looking for is already reflected.
Yes, thank you. Supervisor Bohn?
Yeah, and if Ms. Clem is on there from, Marcellus is on there from HCOG, Are you not doing a study on McKinleyville's, isn't HCOG in the middle of a study on McKinleyville's transit needs?
Yes, I'll unraise my hand real fast. I mean, don't yeah, we are doing a study for McKinleyville with outreach to people that live there. And I will say, any need that is brought forward, HCOG does have a process. We have a Social Service Transportation Advisory Council required by law that really looks at the operational and financial feasibility of every request. So in operational, we work with the operators. Are there roads that can handle a bus? Is it safe? And for financial, we look at the 10% fare box as a minimum for up to 3 years. So not having a crystal ball, I would say with COVID, it's going to be very difficult to make that financial sustainability finding this year. That doesn't mean that next year will be a whole different process, but we will go through that process. It's just going to be very difficult for us to predict that 10% of the ridership will pay for the operations. And the other thing I wanted to mention is that in the past, we have done surveys for Old Arcata Road, for instance. People actually returned our survey saying that they would use the system, and we've got very little ridership. So I'm hoping that the McKinleyville study will be different in that we can get true comments and realistic reactions from the public, not just, oh, transit's good, so I'll say I'll ride, and then they don't ride. So that's one thing that I'm hoping we do a little differently this time with the McKinleyville study.
Thank you, Marcella. And I also, Director Messon, you had your hand up.
Yeah, I just want to clarify that within any motion, could you please include staff recommendations 2 and 3? I did not hear that in the motion. Thank you.
Yeah. Well, definitely, I'm sorry, Director Messon, the public hearing closure is an important part of this process. I did want to ask Marcella just one quick question here. We did have that 70% figure. Have things changed at all in like the last month, or is there any way to know that?
Oh, Greg would be able to tell us, but I did not, unfortunately, I did not ask him. That was the last I've heard.
Yeah.
A report from one of the last Humboldt HTA meetings that I was not present at, but they're still restricted to the 6 feet. There's not very many people that are allowed on buses, so I don't see how it could have improved very much.
Okay, great. Thank you. Supervisor Bohn?
And I think Supervisor Wilson tell you, the numbers are deplorable. The numbers are terrible. Yeah. We're trying to keep what staff we can. You got to understand with the jack passes and everything else, when you take the fact that we don't have full body at CR, full bodies at Humboldt, you have businesses close, you have a lot of people that aren't, those are a lot of our ridership, and it's just not happening. And then a lot of the services that are provided are not being provided for a lot of people to ride the bus. So it's a tough go we're going through right now. And I think Supervisor Wilson, I can't speak for him, but we'll echo, staff at HTA has been juggling a lot of balls, trying to provide as much service. And again, I want to applaud him because, again, I think as Supervisor Madrone can tell you, he came to a meeting about a year ago, maybe not quite a year ago, and we're doing a study. We're trying to look to meet those needs up in McKinleyville. So I think they react pretty quick. So that's a good deal all the way around.
Thank you. Supervisor Wilson.
Yeah, so I'm hoping that we can get a motion that's clean and we can move forward. I want to say too, with the HTA staff, they've been doing a yeoman's job, understanding that the drivers and the mechanics and the folks putting the protections in there. I've actually ridden HTA 2 or 3 times in the last few months myself, and I can tell you that it is not a full bus, and it shouldn't be. I mean, it's all separated out. Everybody's got their mask, and the windows are open, and I can tell you that it's as far as a bus is concerned, it's as safe as could be, but it's certainly nowhere near capacity, and nothing like it was before. Because riding between Arcata and Eureka before, I was on many full buses. in the past. So it's a very, very different situation. So probably not the greatest data point you want to be taking for a study at this moment.
Yeah, good point. Supervisor Madrone.
Thank you, Madam Chair. So yes, I will amend the motion. I very much appreciate the dialogue and the board's support for McKinleyville. And yes, as I said earlier, I don't think now's the time to start something, but I'm hoping that we can build momentum towards next July 1st, when hopefully all of this stuff will be behind us. So with that, I would amend the motion to be that we close the public hearing and that we direct the clerk of the board to forward an action summary, including comments from the public and from the board of the meeting to the Humboldt County Association of Governments for inclusion in their hearing.
Great. And the seconder is all right with that. I just have one comment, not necessarily to the motion, but I would ask both Supervisor Bohn and Wilson, since I didn't really get a good answer when I asked the question regarding what the service actually for the pilot program is looking like in Samoa, because what I've been told is it only serves a specific housing entity. So perhaps some other time someone can point me in the right direction or just tell me to talk to Greg Pratt. I just am trying to get some information and I thought you guys might have known. So I will follow up after this meeting. And if one of you has the best direction to send me, please let me know.
Supervisor, thank you, Supervisor Bass. Supervisor Bohn?
And just so you know, no, it is not a specific service to any apartments. It is a public transit bus that will be going over for all members of the public, not just for one housing allotment. Do I know where? But it's not just for one housing. So if we need to set up another stop, I mean, we can, they take time. We have to figure that out. And if it warrants it, it will certainly happen the way I understand. And I just happened to look back on the last meeting. We are still down about 70% at HTA. And so, I mean, yeah.
No, the only reason I'm asking is when I was over there, it sounds like they're going to do a specialized type of van service as a pool. I mean, as a pilot. And so perhaps they need to reach out to Greg Pratt, because I'm just thinking there could be doubling of efforts, perhaps, that wouldn't be good for the either pilot program. So that's all. I will follow up with it over there with the
talk to me afterwards.
Developers.
Okay.
Thank you very much for great discussion, and thank you, Marcella, for your help there, and Director Mattson. Ryan, let's go to a roll call vote, please.
Thank you, Chair Fennell. Supervisor Bohn?
Yeah.
Supervisor Wilson?
Yes.
Supervisor Madrone?
Yes.
Supervisor Bass?
Yes.
And Supervisor Fennell?
Yes.
Thank you. Passes 5-0.
Thank you, Ryan, and thank you, everybody. That's it for today's meeting. One of the shorter ones practically since we began this pandemic. Everybody get out there and vote and have a wonderful day. We are adjourned.
Good luck, Estelle.
Thanks, Rex.